As we have started the viral type of conjunctivitis, and previously we discussed the adenoviral conjunctivitis with details. Now we will discuss the other types of viral conjunctivitis. Okay. So viral type of conjunctivitis, it is the acute, mostly acute follicular conjunctivitis, which is characterized by redness and watery discharge. Mostly acute follicular, characterized by redness and watery discharge. Okay. I also told you that I have made a mnemonic which represent these viruses which causing conjunctivitis. This is the palm conjunctivitis causing microbes. So every capital letter of this mnemonic represent the virus. For example, picornavirus, herpes simplex virus, adenovirus, measles virus, coronavirus, chickenpox virus, and molluscum contagiosum virus. Previously we discussed the adenovirus conjunctivitis with details, okay? Because we discussed it firstly because it is the most common virus which is involved in viral type of conjunctivitis, okay? Now we will discuss the other types of viral conjunctivitis. But remember guys, I have made it very simple and very easy. For all these viruses, the clinical features, the diagnosis and the treatment, these are mostly similar, with the exception of few clinical features which I will point out that how can you differentiate these viral types of conjunctivitis. So most of the clinical features, they are similar with the exception of few. Okay. So we will now discuss the etiologies and epidemiologies, and then we will come to these common clinical features and what are the other clinical features which can differentiate these viral types of conjunctivitis. Okay. So the first one is the picornavirus conjunctivitis. It is etiology that it is caused by enterovirus 70. Enterovirus 70, it is a virus which belongs to this picornavirus group. Picornavirus, it is a group and a member of this enterovirus 70 causing this type of conjunctivitis. Epidemiology is that this is a highly contagious disease. Its incubation period is only 1 to 2 days. Okay. So when it inoculates into your eyes, it will cause the infection only in 1 to 2 days. It is mainly prevalent in people living in a crowded environment, and they have poor hand washing practice. Okay, and they belongs to a lower socio-economic status. Okay, so this is the epidemiology of the picornavirus conjunctivitis. Now the herpes simplex virus conjunctivitis. Herpes simplex virus conjunctivitis, it is mostly prevalent in young children and adults, and it is mostly associated with the herpetic infection of the skin and lid margin Okay, so what will it can develop? This herpes simplex virus conjunctivitis can develop without these infection, without the herpetic infection of the skin and lid margin. But mostly what is happening, that mostly when there is the infection of the skin, of the lid margin in other body parts, what will happen? There will be the formation of vesicles. There will be the formation of vesicle in which these viruses are present. Okay, herpes simplex viruses, these are present in these vesicles. So when the virus infect the skin, so okay, it will make vesicle, and these vesicle will shed. If there are vesicle on the lid margins, these vesicle will shed into the eye, and what will happen? The virus will cause conjunctivitis. So mostly this virus, herpes simplex virus conjunctivitis, is associated with the formation of these vesicles. Okay, but this virus can cause this type of conjunctivitis without these vesicles. But mostly the infection is associated with the formation of vesicle on the lid margins. Okay, and epidemiology, remember one more thing, that this infection is mostly associated with the primary infection of herpes simplex virus. How? Because the herpes simplex virus, we know that it can also cause recurrent infection. First of all, it will cause the primary infection in young children and adults. When there are stress or there are other activating factor for the virus will reactivate and will again cause the infection. But But this herpes simplex virus conjunctivitis is mostly associated with the primary infection. When they primarily infect the young adults and children, so they are causing this type of conjunctivitis. Okay, so this is the epidemiology. Now, the molluscum contagiosum virus conjunctivitis. Molluscum contagiosum virus, it is a virus which belongs to a pox virus group. This virus is also mainly causing the infection in young children and adults. And this virus is mostly, it is the infection of the skin and less commonly conjunctiva. Okay, and it's spread by direct contact with the infected person. So it is in epidemiology, molluscum contagiosum virus belongs to a pox virus group. This is mostly the infection of the skin and less commonly conjunctiva. It is mostly involving the young children and adults, and it is spreading by direct contact with the infected person. Okay? Now, the coronavirus conjunctivitis. Coronavirus conjunctivitis, the virus is severe acute respiratory syndrome coronavirus 2. So, SARS coronavirus 2. This virus was first identified in China and Wuhan in 2019. And this virus is causing mostly the systemic disease. As from the name, it is appearing that SARS coronavirus 2, SARS severe acute respiratory syndrome. So it is mostly causing the respiratory infection. Okay, but there are 2 to 33% chance that the patient having the systemic disease may also have the conjunctivitis. Okay, so it is mainly the systemic disease, but 2 to 33% people may have the coronavirus conjunctivitis, as the virus will migrate from the nasopharynx to the nose, and from the nose to the nasolacrimal duct, and from the nasolacrimal duct into the eye, or the virus can directly inoculate into the eye from the environment. Okay, this is the coronavirus conjunctivitis. Now we will discuss the clinical features for all these viral types of conjunctivitis. Okay, we know that there will be redness and watery discharge, but remember I told you that most viruses, they have watery discharge. Okay, with the exception of two, the molluscum contagiosum and the coronavirus. The molluscum contagiosum, it has mucoid discharge. Okay, it has mucoid discharge, and the coronavirus conjunctivitis, it will have mucopurulent discharge. Purulent. Okay. So there will be the redness and there will be the watery discharge in most of these viruses, with the exception of two, molluscum contagiosum and corona. Okay, then we will have conjunctival response. We have three types of conjunctival response. The first one is the subconjunctival hemorrhage. There may be the subconjunctival hemorrhage. Under the conjunctiva there may be hemorrhage. If the infection is severe, there may be hemorrhage in the patient. So the subconjunctival hemorrhage, the conjunctival response may be the formation of a zoodomembrane. Zoodomembrane is when there is an inflammation, there will be exudate. So when the exudate accumulate in this conjunctiva and on the surface of conjunctiva, it will cause the formation of a membrane. And this membrane can be zoodomembrane or true membrane. But in the viral types of conjunctivitis, there will be a zoodomembrane. Zoodomembrane is formed by when there is the exudate, when there is the coagulative exudate in the conjunctiva and on the surface of conjunctiva. It will accumulate and it will form a membrane, which is called a zoodomembrane. And this membrane is called zoodomembrane because this membrane can be separated. There will be the formation of a zoodomembrane, and this membrane can be separated, can be peeled off easily without any bleeding. If it is cause bleeding, if by peel off the membrane it causes bleeding, then it is called true membrane, and which is caused by fibrinous exudate. But in the viral type of conjunctivitis, we have the zoodomembrane. This membrane is caused by coagulative exudate. By peeling off the membrane, it will not cause any bleeding. So that's why it is called exudomembrane. So we will have subconjunctival hemorrhage. In the conjunctival response, we will have the exudomembrane. Okay. And the last, we will have chemosis. What is chemosis? Chemosis is the edema of the conjunctiva. Okay. There will be chemosis. So when there is the viral infection, what will happen? There will be the edema in the conjunctiva. And the edematous fluid will push the conjunctiva outward. And this bulging out of the conjunctiva due to edema, this is called chemosis. Okay. So there will be chemosis. Okay. There will be chemosis. The conjunctival response can be subconjunctival hemorrhage. There can be exudomembrane, and there can be chemosis in which the edema bulge out the conjunctiva. Okay. These three types of responses may be present or may not be present. Okay. So it depends on the severity of infection. It may be present or may not be present in these viral type of conjunctivitis. Okay. Now we will also have keratitis. Keratitis is the inflammation of corneal epithelium. Okay. So there will be keratitis. Keratitis is when there is the inflammation of the corneal epithelium. Okay. And this keratitis may result or it may progress to corneal opacities, and there will be the opacities in the cornea. Okay. So there will be the opacities in the cornea. So keratitis may resolve or it may progress to opacities. Now the person with the viral infection will have pre-auricular lymph adenopathy. So the pre-auricular lymph nodes, they will also be involved, and this is called pre-auricular lymph adenopathy. It will also be present in viral types of conjunctivitis. So we will have redness, discharge. Discharge is watery, but in molluscum contagiosum and corona it is different. We will have conjunctival response. It may be subconjunctival hemorrhage, it may be exudomembrane, or it may be chemosis. We will have keratitis. There will be the inflammation of the cornea. Okay. And remember, in adenovirus we discussed that the keratitis will be 80%. In 80% cases there will be keratitis. But in other viral conjunctivitis, the percentage may be different. Okay. But there will be keratitis. We will have pre-auricular lymph adenopathy. Okay. The pre-auricular lymph nodes will also be involved. So these are the clinical features which are similar in all these viral types of conjunctivitis, with the exception of this. So how can we differentiate these viral types of conjunctivitis? As we know that in the picornavirus, we can estimate from the epidemiology that it is prevalent in people living in crowded environment and having poor hand washing practice. Herpes simplex virus, mostly in the herpetic infection, we will have the vesicles. Okay, there will be the formation of vesicles. In the molluscum contagiosum virus, we will have the mucoid discharge, and there will be other. In molluscum contagiosum, with the addition of the mucoid discharge and these clinical features, we will also have some types of nodules, and these nodules are of two types. We have nodules which are present on the lid margins. We have nodules which are present on the lid margins like this. Okay, on the lid margins. These nodules are called molluscum nodules, and we have nodules which are present away from the lid margins, and these are called umbilicated molluscum nodules. So that's what these are called umbilicated molluscum nodules. It will have depression like umbilical in its center. That's why they are called umbilicated molluscum nodules. So we will have two types of nodules, the molluscum nodules and umbilicated molluscum nodules. And these nodules will also, like the herpes simplex virus conjunctivitis, the virus will shoot from these nodules and will cause molluscum contagiosum virus conjunctivitis. Okay. So in molluscum contagiosum virus conjunctivitis, we will have all these clinical features with mucoid discharge in these nodules. Okay. Now in the coronavirus conjunctivitis, we will have all these clinical features with the exception of mucopurulin, with the addition of mucopurulin discharge plus the person will have systemic disease. So the person will present to you with respiratory type of infection and mucopurulin discharge from the eye and all these clinical features. Okay. So most of the clinical features, they are similar for all these viral types of conjunctivitis. Okay. Now with the diagnosis, how can we diagnose the condition? The diagnosis for these viral types of conjunctivitis is generally not required. Why? Because these are viral infections and viral infection is mostly acute. So diagnosis is not generally required, but we can diagnose. We can use rising titer of antibodies. We can check in the serum the rising titer of antibodies against the virus. Okay. We can also do PCR. We can also do ELISA, enzyme linked immunosorbent assay method. Okay. Now the treatment, as these are the viral infections, so these are mostly self-limiting. So they generally does not require any treatment, but we can do symptomatic treatment. Okay. We can prescribe antiviral, but antiviral are not so effective. Okay. We will prescribe antibiotics. As the condition is viral, so there is the chance of secondary bacterial infections. So we will prescribe antibiotics. Okay. We will also give the patient steroid in dilute concentration. As steroids is generally not prescribed in infective types of conjunctivitis, but we can prescribe the patient steroids in dilute concentration. As I told you, there can be a formation of corneal opacities, so there will be the discomfort for the patient. So in the vision there will be discomfort for the patient, and the vision will be blurred. So in order to get the patient comfortability, we can give steroids in dilute concentration. Generally, the steroids are not prescribed in infective type of viral conjunctivitis or any bacterial conjunctivitis. But in infective types of conjunctivitis, we do not prescribe steroids. But in order to remove the opacities and to get comfortability to the patient, we can prescribe the steroids in dilute concentration. Okay. So the condition is self-limiting. It does not require any treatment. Antiviral can be given. Antibiotics should be given, and we can also give steroids in dilute concentration. So the clinical features, most of the clinical features, the diagnosis and the treatment, these are similar for all these viral types of conjunctivitis, with the exception of these vesicles and the herpes simplex and molluscum contagiosum virus and the systemic disease and coronavirus. Okay. So now it has covered all the viral types of conjunctivitis. I also have prepared notes. I will get the link in the description. You can also go through the notes and can learn more. Thank you for watching the video.